What's going on, everyone? Happy Thursday. Hopefully, everyone is doing well, staying safe, healthy. If you had to take a COVID test, flu test, RSV test, maybe some other virus, I hope you have tested negative. If you did test positive, I hope you have a full and speedy recovery with no long-term issues and no long COVID issues. It is time now for the Thursday edition of the Virus Update for Thursday, March 6th, 2025. If you are new to my channel, welcome to my channel. This is where I do the daily virus update on all those viruses that can make us sick. Let's face it, the COVID pandemic started back in 2020. COVID itself started back in 2019. Ever since then, there have been so many strange things happening. Have you noticed so many people sick lately? I sure have. It's one of the reasons why I start this channel. No, I'm not a doctor. I'm just a concerned citizen, a reporter, an independent reporter that is very concerned on what's going on with these viruses. Each and every day I gather all the news, I gather all the data, anything I can find to help keep you safe and informed of what's going on with these viruses. Want to stay informed? Just subscribe down below. Give this video a thumbs up. Hit that notification bell and share this video with anyone you know. And of course, leave your comments down below. Hey, we're trying for 10,000 subscribers this year. I think we're going to get that. Alrighty, we have just a few news stories today. We do have some new data out of the UK. We have some data from Ohio. I think we may have some data from Washington State. And we'll have to see if any of the other states updated yet. And of course, we do have some data from CJS. I don't think this is going to be as long of a video today, but let's see what happens. North Carolina, flu deaths surpass 300. Seniors most affected from this. So, flu deaths continue to rise in the state of North Carolina, and it shows that there have been 70 deaths reported between the ages of 56 and 64, 24 between the ages of 25 and 49, and they were age range of 18 to 24 years old, 2 deaths, and there have also been 2 deaths between the ages of 5 and 17 years old at this time. Those over 65 are the ones that are dying the most. Take a look at this. Can we zoom in this chart? Yeah, it looks like that number is approaching 200. Yeah, that's not a good thing. Over 65, 200 deaths. I mean, it's the age that it usually would happen, but it's just still sad to see people dying of flu. Long COVID warning. Silent organ damages, real problem. And I believe this article is coming from New Zealand, just based on the website. Yes, this is New Zealand. Public health experts are urging the government to protect people from long COVID, which they say could have already affected 250,000 New Zealanders. That's a big number for a country that at one time had very strict policy. And when I mean strict policy, in the early days of the pandemic, when things were shut down in various different countries, New Zealand took it a step further. No tourists, no visitors whatsoever. They had level 1, level 2, I think they had level 3 lockdowns that would go into place at times as well. Their deaths were very low. Their hospitalizations were very low. They were doing things right. Then they pretty much said, to hell with that, and let things go. And, well, we see what has happened. Now, the whole world has said to hell with it. But, yeah, we see what is happening now in New Zealand. And, yes, this is something that's happening in many countries. People getting long COVID. It's bad. Look at this. As many as 400 million people. 400 million. That's a huge number. Worldwide, about 5% of the global population have long COVID. I can raise my hand. I have long COVID. I did something today I don't normally do. I took a daytime nap. I laid down around 10 a.m., woke up. It's 1 o'clock in the afternoon. Yeah, that doesn't usually happen. And as we speak right now, the headache is driving me absolutely insane, but we will continue with this update anyhow. State health experts worry bird flu could become another pandemic. This is in Boston. No human cases of H5N1 have been reported in Massachusetts, but there have been reports in other states, and we did see yesterday from the CDC that wastewater is showing some detection of it. Do I still have that up here from yesterday? Yeah, I do. Wastewater is showing some detection of it in Massachusetts. There you go. It is in the Boston area. So, yeah, I'm concerned about it as well. I can never say, will it go a pandemic, will it not go a pandemic? It's more so of a matter of when will it do it. But, I mean, there's still a chance that, hey, I'm going to try and be optimistic here. there's still the chance that we could somehow do something to maybe stop this from becoming a pandemic one day. But right now, the main spread is coming from farm workers, people who work on farms. They are getting it. And as far as we know, it has not gone human to human yet. I have said several times before, I'm extremely concerned what will happen down the line with hunters. You may recall I showed this the other day here in Pennsylvania. You probably can't see it, but hunters are out hunting ducks, and the ducks that they are killing are turning up positive for H5N1 bird flu. Yes, bird flu in ducks. So, I mean, hunters going out there having contact with these birds that are sick, they could in return get sick, and who knows, that could be a spread of it as well. All right, moving on to this. Dennis the COVID guy in New South Wales respiratory surveillance report, this is over in Australia, reports week ending for March 1st, 2025. COVID positivity rate is 6.1%. That's down by 0.1%. Number of laboratories reporting COVID, 2 out of 4. COVID is 1,731 cases. That is up by 8.8%. Influenza, 1,462 cases. That is up by 8.9%. RSV, 1,065 cases. That is up by 9.5%. So you have to remember something. We're about ready to enter spring here in the United States. They're about ready to enter fall. After we enter spring, we enter summer. After they enter fall, they enter winter. So their respiratory virus season is going to be going up. And quite frankly, to be honest with you, influenza over there got an early start. We had a bad influenza season. They had a bad one. Remember the Australia Open? Yeah, influenza. There was talked about going up then. All right, pertussis, whooping cough, week ending March 1st, 2025. Pertussis or whooping cough notifications have dropped over the last 3 months. That's a good thing. The highest rates of pertussis notifications are observed in children ages 5 through 14 years. Rates of RSV notifications per 100,000 population week ending on March 1st. Rates of RSV notifications have been increasing over the last 2 months, with the highest rates in children ages 1 year old. And moving on to variant sequencing, it looks like XEC is 62% of the cases, LP.8.1 is 12%, so they are behind what's happening here in the United States. And it looks like, as for wastewater, just only a couple areas are going up at this time, while 2 other areas are going down at this time when it comes to wastewater. All right, taking a look at this in Canada. Yes, we actually have more international news than normal today. That is a good thing, because we don't talk about enough about some of these other countries. 5 years later, COVID-19 continues to leave its mark on Albertans. And I got to be honest with you, as much as we're talking about these other countries, it's not necessarily good news, because look at this. Doctors worry patients with long COVID may be overlooked as crisis fades. Yeah, it's definitely an issue. 5 years after the province identified its first COVID-19 case, Albertans are being urged not to lose sight of those still struggling with its devastating impacts. Yeah, this is a real problem in many different places. Since then, it says here, since March 5th of 2020, 6,691 Albertans have died due to COVID. That is really a high number that have died due to COVID. And wait till you see the number of people that are dealing with long COVID in Canada. Yes, as of June 2023, about 100,000, let me highlight that, 100,000 Canadian adults have been unable to return to work or school because of their symptoms, the report said. So these are the ones that are having severe long COVID. Total number is probably even higher than that. Yeah, really bad. I mean, we're seeing a lot of these stories lately. 5 years later, North Carolina had one the other day. I don't think I shared it, but we're seeing a lot of these stories starting to pop up now. It is a real problem, and while we're at it, let's see what's going on in Canada. The COVID-19 viral level is moderate. Flu A is currently high, Flu B is moderate, and RSV at this time is also listed in the moderate category. Taking a look here, here's the website. Let's refresh and see if there's anything new in the recent topics to show. What's this? Paxlovid offers little protection in well-vaccinated senior citizens. Yikes, that's not good. Let's read, shall we? The antiviral drug Paxlovid may not offer as much protection against COVID-related hospitalizations or deaths for vaccinated older adults. After all, Paxlovid didn't lower hospital or death risk for vaccinated adults 65 to 74. It may still benefit high risk or immunocompromised experts. The study was recently published in JAMA Network Open. And the reason why I have to pause and say wow like that is because that's a very credible news source, JAMA Network Open. But remember, always consult your doctor or physician if you test positive. Go with what they tell you to do, not directly from what a study says to do. So, I mean, I'm not a medical professional. Just go with what they tell you to do. But to read a study that says that, yikes, that's not necessarily a good thing. All right, moving on now to the UK this week. And let's just start off with COVID there. Unfortunately, I think the UK may now be starting to trend into another wave. Remember, they were having those little mini increases. Well, those little mini increases are getting a little bit bigger now. They're up to a 93 case increase, 10.6%. Weekly cases, 968. It looks like the deaths are down slightly. That's good, but that's the last lagging indicator of a wave. 67 deaths there, so we would not expect that to rise right now. If deaths were already rising, that would mean we're missing a lot of cases, a lot of possibility. There would be a lot of missed stuff. Patients admitted, that is showing the same number from January 31st. So that has not updated. But again, when we go back to the other viruses here, you're going to see here's COVID. Yeah, look at that chart. It's starting to go up again. Mind you, they're likely missing a lot of cases thanks to these guys right here. At-home COVID testing kits. I always show that same at-home testing box as my example, but it really is a good example, and in this case it would be influenza. We won't go deep into that. Influenza is dropping at this time. RSV continues to drop. HMPV, it's just bouncing off the bottom. It's not really rising. Endovirus, not much of a problem there. Rhinovirus is dropping. So we can see here there's a lot of different viruses. Come down to some of these other ones. Yeah, not terribly concerning at this point. I'm looking to see where's Mpox at. Here's measles. A little uptick in measles. Doesn't look like that has updated. I don't know. Did Mpox update it? They've had 10 cases of Mpox clade 1B this year. Yikes. So that is still out there. Taking a look at what is going on with the air qualities in the United States, and I can tell you, they may or may not be bad in these. It is extremely windy in the eastern half of the country. You may hear it behind me. It is really windy today. I mean, it is just ridiculously windy here. West Coast, just a few problems. Overall, there's a lot of green on this map. That's a good thing. It is not that bad of a day for air quality. Something is going on in Massachusetts, eastern Massachusetts. I don't know why there's so many yellow sites there. Just random that's happening there. Moving on. Taking a look at this, Pinellas County, Florida. Multiple sick person calls at this time. That is never a good thing. And I do need to check and see what Philadelphia did. Yes, there it is. 810 EMS calls. That is over 800. That's never a good number to see. Let's see if Philadelphia has had its weekly update yet. I've been refreshing it all day. Last week, it updated on Thursday, and now there's nothing. So, can't give you an update on that, but I can show you this. Just a little bit earlier in Montgomery County, there were quite a few calls for cardiac arrest. Yeah, there was not one, not two, but three at a time. That's never a good thing. Let's do a live look in and hope that we see zero cardiac arrest calls. And we do, but we do see cardiac emergency show up 3 times. And sometimes cardiac emergency, that can sometimes turn into something more significant, such as cardiac arrest. So, yeah, not a good day for Montgomery County, considering that there have been so many cardiac arrest calls there today. And let's see what's going on in Chester County. And, oh, look at that. We do find a cardiac arrest call in Chester County as well. So, that's just not good whatsoever. All right, moving on now to the hospital. Look, and let's see what's going on with the hospitals in Pennsylvania. Yeah, I do need to refresh this. And as far as I know, yeah, South Central Pennsylvania is not doing bad today. Southeast PA does have a few hospitals that are doing bad, and I want to take a look at this. Riddle Hospital is doing bad. Take a look at some of these green hospitals. There's one particular, yeah, Crozier Chester Medical Center. We may have a problem in Chester County, Pennsylvania going forward. I'm hearing reports, I don't know if they're true. I hope they're not true. I'm hearing all hospitals in affiliation with Crozier are going to be shutting down soon. If that's true, we have a big problem. Because hospital capacity, as you can see here, it's already stretched in that area. I mean, look at the gaps in between where hospitals are located. Look down here. You can see here. Some parts of Chester County. Not much in the way of hospitals. So, yeah, that's definitely a huge problem. And maybe they're just not listed on the map. I would like to think maybe there's a hospital somewhere in this area. But if they close, that's one less hospital in Chester County. That's one less hospital in Delaware County, I should say, because they have the Crozer Chester Medical Center. That's actually Delaware County. The point is, both counties are going to be impacted by this. You close one hospital, well, now you're sending people to such and such hospital. That hospital gets filled, and then a domino effects to this one. You get the point. Connect the dots here. Not a good thing. Lehigh Valley, Pennsylvania, continuing to deal with some problems today. Taking a look at what's going on in New Jersey, and I'm happy to report that New Jersey does not look to be doing bad. Look at that. Look at that. All with exceptions to Penn Medicine, Princeton Medical Center, where they're having a psychiatric issue, and this Inspira Medical Center having some sort of a specialty issue. Not bad today. All right, moving on now to New York State. 1,135 new cases reported there. Hospitalizations, I am happy to report they are continuing to drop, not just on the statewide level, which is 734 hospitalizations and 70 people in the ICU, but take a look at this. New York City is dropping at this time. Come on, let's get to New York City, shall we? There it is. Look at that. New York City, 328 hospitalizations, 33 people in the ICU. Taking a look at what is going on now in Washington State, if we can. See, did this update here? It does, yes, it looks like it updated here. The number of people using the hospital for COVID, that is dropping at this time. That is a good thing. And we can see here wastewater. Yeah, there's still a few areas around Seattle and a few other isolated areas that are still doing bad, but you're starting to see more blue show up, indicating that COVID in Washington State is getting better. That is really a good thing to point out. Alrighty, let's stop and take our hydration break, shall we? I definitely need my hydration break. It is always important to keep yourself hydrated. Remember to drink water. That was today's drink of choice. All right, taking a look at what's going on with Ohio here. And cases in Ohio, I'm happy to report, not only are they dropping, the drop is starting to pick up the pace. 3,110 cases reported. And that is a good thing that they are dropping. Still high, but nowhere near as high as they were during the peak. Of course, this is refreshing on us. Hospitalizations are dropping. Hospital admissions are dropping. However, the deaths did rise for today. There we go. It's back with us now. The number of people in the hospital, or the number added to the hospital count, that's the way they do it there. 144. In the ICU, 7. Deaths went up by 1. They added another 44 deaths, so that's 1 higher than last week. Remember, deaths are always at the backside of a wave. Alrighty, let's take a look at some data now from CJS83172. As always, thank you for leaving comments with your reports on my videos. Tuesday's numbers. Florida had a daily count of 301 new COVID cases. This is all COVID now. New York, 754 new COVID cases on Tuesday. Puerto Rico, 184 new cases. Now, weekly numbers. Maine, 191 new cases and 4 new deaths. Maryland, weekly number, 980 new cases and 16 new deaths. Michigan, 2,000. Still a high number. 2,412 new cases and 14 new deaths. And I want to bring that reminder up again. That's with at-home testing. That's really bad. 2,412 new cases and 14 deaths. Wow. Virginia, weekly number, 2,579 new positive COVID tests and 23 deaths reported by the CDC data tracker last Friday. All right, Wednesday's numbers, yesterday. New York, daily, 664 new cases. Puerto Rico, daily, 171 new cases. Delaware, weekly, 294 new cases and 9 new deaths. That's a lot of deaths for Delaware. North Dakota, 173 new cases. Nevada, 200 new cases. Oregon, 5 new state-reported deaths. South Dakota, 166 new cases and 6 new deaths. That's high for them when it comes to deaths. Washington, weekly number, 306 emergency department visits and 6 new deaths. Alrighty, folks, that does it for the Thursday edition of the Virus Update. If you enjoyed this update, give it a thumbs up, subscribe down below, hit that notification bell, share this video with anyone you know, and leave your comments down below. I will see you all again tomorrow, where we will have updates from the CDC. Any news of the day, hopefully it's another slow news day. I really hope, because that would mean that things are getting a little bit better. But I think we're going to continue to start to see more international stuff. UK is definitely headed towards a potential wave. I don't know how big that's going to get. Australia, we have to keep an eye on that, and New Zealand as well. So we'll have to see what happens on the international front. All right, see you again tomorrow. Until I see you again tomorrow, stay safe, everyone. Have a fantastic Thursday evening, and thanks for watching. Take care.